Good afternoon, ladies and gentlemen, and thank you for the opportunity to comment on what I thought was an excellent and thought-provoking paper that Kieran has given. It's the first time I've heard it, and so I was listening intently and thinking about it in the context of my role as a hospital chief executive, and I guess the person responsible for engaging doctors. In my organisation, we are a private not-for-profit organisation, so the doctors are by and large not employees, but more similar to partners. There were four themes in Kieran's presentation that I just wanted to pick up on in my comments. The first was, I think, implied but not absolutely stated. That is the theme of compliance versus variation, if you will. And I particularly liked Leonard Cohen's quote that you need a crack to let the light in. And I think the challenge is, well, we can prepare perfectly formed doctors, but to what extent is practice variation an essential part of driving our system forward? The second theme that he touched upon was delineating health and care. The third theme, the last 3 feet of communication, the clinician-patient interface and the interpersonal encounter therein. And the last thing that I just wanted to touch upon in my commentary is the question that he posed about whether improved health metrics are the equivalent of improved care. And he gave the example of the 4-hour transition time in an emergency department as an example of improved health metrics, improved access, which may or may not lead to improved care. Fit is a great word, I think, and I looked it up, and it's an adjective that has 3, I think, very opposite meanings. The first is, as my previous discussant talked about, in shape. So someone who is physically, mentally, spiritually in good health. And the proposition is that such a person will be a better practitioner, will provide safer care. The second adjective meaning for fit is appropriate, so that they are proper and suitable for the setting within which they're working. And again, this is the context proposition that Kieran put forward. And the third adjective meaning for fit is that they're ready. That is, they're ready to go, they're going to hit the ground running, they're going to do what they're required to do, what they've been engaged to do. And I think all of these meanings have, adjectives have meaning in the context of the fit professional, particularly from the point of view of an employer or someone who accredits a doctor to work in their hospital. We make the assumption that if they have a college stamp, that they are fit to practice, and that all of those 3 adjectives apply. A couple of words on the importance of context, and I think this has been touched upon very thoroughly. These days there are significant societal expectations about the role of specialist practitioners, the role of general practitioners. Increasingly, people who use our services expect to be able to see clinicians of all varieties working together as a team and communicating with one another. And these societal expectations have an impact upon the way patients and their families interpret what's happening. Another important thing in 2012, perhaps less important in 1980 or 1960, is culture and cultural differences. We live in a multicultural society in Australia, and many of the folk that clinicians will come into contact with will have very different cultural and ethnic backgrounds. And there's all sorts of evidence now about ways of communicating and how communication is interpreted given different cultural backgrounds. So moving along from the context in a societal sense, the next point I wanted to make is about fit within the system. Kieran again touched upon this, and he referred to the role of governments and bureaucracies in creating the landscape at a helicopter level. A couple of points I wanted to make were, first of all, the underpinning logic of much of our system now and the way it is regulated and structured is about empowering patients and families to make choice. And if I quoted the words of the IHI in the US, Don Berwick, nothing about me without me. So there is this notion that fit professionals should be extraordinarily good at communicating choices. But at the same time, we are challenged by the fact that the evidence on patient and family literacy about the sorts of choices that they have to make is not good. In fact, last week I happened to be attending a presentation by the Australian Institute of Health and Welfare, who look after My Hospital's website, just pointing out that the forums that they have conducted on what people might get from My Hospital's website in terms of how they make their choices just demonstrates that the sorts of ways of communicating good and bad outcomes, good and bad metrics in terms of infection control, etc., are generally not well understood by the general public. So there is a real challenge in terms of communication. Next point is to do with fit with the organisation. So in my case, my organisation has a strong mission and values, and we like to think that the practitioners who come and work with us in our organisation share our values of respect, compassion, courage and integrity. This, in a way, adds a sense of purpose to work, and I would quote some the thinking of Daniel Pink, who wrote a book called Drive, which is about motivation. And interestingly, he proposes there are three strong characteristics of motivation: autonomy, mastery of the science and art of clinical encounters in this case, and purpose. And I think this notion of shared purpose between the practitioner and the team or organisation within which you're working is critical to success in your profession. So I'm left with the challenge, I guess, of reconciling the notion of compliance with a CanMEDS type structure with the notion of autonomy, with the notion of cracks, with the notion of change to drive the system forward. And I think from me as an employer of doctors, it provides an obligation to provide feedback. And the question is, well, from whom should this feedback come? We've had some discussion about feedback from peers. I think the concern that I've experienced over my years working in the health sector is that often peer feedback comes too late and it's quite timid. The alternative is to provide more structured feedback from the employer, from an arm's length mentor or friendly critic. And I think this is something that we could look to adopt. So overall, I thought it was a very stimulating presentation, and I thank you for the opportunity of commenting.